So, in the US in medical school, we learn this little rhyme for reactive arthritis, and it's called can't see, can't pee, can't climb a tree. And it's really nice because it's a triad that describes the symptoms that a patient with reactive arthritis gets. So, we'll start with can't see, right? That includes eyes. So, patients with reactive arthritis can get either conjunctivitis or uveitis. Conjunctivitis, we all know, like pink eye, and uveitis, which is inflammation of the anterior chamber of the eye. Now, neither one of these is actually infectious. It is just your own immune system attacking the eye or portions of the eye. The second one is can't pee, and that includes urethritis, which is inflammation of your urethra, which in fact doesn't actually make you stop peeing, it just results in painful urination, but that wouldn't fit in the rhyme. A cervicitis, which actually has nothing to do with urination, but is in the area, and in fact, inflammation of the cervix can give you dysuria. And so patients will have painful urination from either urethritis or cervicitis. And can't climb a tree, of course, describes the arthritis portion. So, what kind of arthritis is it? Well, it's arthritis that's usually of the large joints, so not the small joints of like the fingers and the toes, but more like wrists and knees and ankles. The arthritis is usually asymmetric, um, and that asymmetric implies that more than one joint is involved. So often patients will have inflammation of, let's say, the left wrist, and then that will start to kind of get better, and then they'll get inflammation of the right ankle. And then it will start to get better, and then they will get inflammation of the left knee. And so the pattern of joint involvement is asymmetric. And it's something we call oligoarthritis. Although patients can have just one joint, but typically you'll have an additive or migratory oligoarthritis. And it's more common that joints of the lower extremities are involved, but wrists and elbows have certainly been described as well. And if you take a sample of the synovial fluid from these patients and you send it for culture, the culture should be negative. And this is what makes it quite different from the gonococcal arthritis we just talked about in the last few slides, is that this is not actually an infection, it's an immune reaction to an already resolved infection. And so the fluid should be aseptic. Now, in addition to the classic triad, can't see, can't pee, can't climb a tree, patients can get other extra-articular, so outside of the joint, symptoms in reactive arthritis. And most commonly, those include enthesitis, which is a very fancy word for describing inflammation of the area where your tendons and muscles insert into the bone. And most commonly, this happens in the Achilles tendon in the back of your heel. And so patients have pain in their ankle, but without actual inflammation of the ankle joint. So you remember when you examine their active and passive range of motion, that will be normal, but they still have pain when you palpate along the Achilles tendon. They can also have dactylitis, and this can occur in up to 40% of patients. And it's also a result of this inflammation of the tendons inserting into the bone. And dactylitis is a fancy word for saying sausage fingers. So patients will have very fat-looking fingers, just like that in the picture. And in addition, they can have various skin manifestations. Most commonly described as this like scaly red patches that may occur on the face that kind of look like psoriasis, but in a patient who doesn't have psoriasis.